Oh, I don't hear you, Dr. Logan. You need to unmute. No. Can you unmute? Oh, I'll unmute you. There, you're unmuted. Talk again.
Okay, all right, am I there now?
You are.
Okay, my problem right now is that I don't see the screen again. I'm gonna see if I can get that coming back.
Okay, do the rest of you see my screen?
Yes.
I see it.
Okay, are you seeing the diseases PowerPoint?
Yes.
Great, thank you.
And that's what I am not seeing, so. Well, I apologize, Robin. I don't know what I'm doing wrong here, but.
That's okay. Let's see. I'm trying
I
to.
had everything there for a minute, and then everything left. So.
I'm trying to think. What did you click anything that you?
Well, I don't think I did.
Okay.
There, now it's back. Okay.
Great.
I think I see it. So.
Okay, great.
All righty. Well, we'll go ahead and get started. Hello, everybody. We'll try to save some time at the end of this for questions and answers. So we'll go through. If you have an absolutely burning question as we're going through it, go ahead and stop me and we'll answer it while we're at that particular part. But Robin had asked me to visit with you tonight about diseases that are common, not so much necessarily in just exhibition livestock, but diseases that are fairly common in Wyoming and certainly could be common in a 4-H or an FFA project. And so the main purpose of my visit with you tonight is to try to exhibit or to educate exhibitors about conditions in livestock as well as companion animals that could influence their ability to be entered into the state or county fair, and basically to educate exhibitors on the causes and the consequences of these diseases, as well as the potential for some of these diseases to be spread either to other animals and in some cases to humans as well. So let's go to the next slide. And I think the key thing here is that very first statement that common sense is key, and as is prevention of these different diseases. So remember that these shows, jackpots and county fair and other fairs and shows, are truly a showcase for the livestock industry. And so we really want to have the very best of the best being on exhibit at these events for the public to see. And if somebody takes an animal that is not healthy or has physical problems, the wrong message really is sent to the public, and this can have some really bad negative effects for the agriculture sector. So it's real important to make sure that you take only your best animals and make sure that they are healthy. And as I told Robin earlier, I'm not going to read down through every single one of these bullet points on these slides. You can read those, and if you do read through them after this at some point and have questions, Robin can give you either my telephone number or my email address, and I'll be happy to visit with you about these things. So let's go ahead and go to the next slide. Again, the requirements for a show, state fair and most of the county fairs now, and I would hope that most of the jackpots are requiring a veterinary health certificate and a veterinary health inspection to be issued prior to an animal going to these events. And the intent of this is to identify animals that may have infectious or contagious diseases and prevent the spread to other animals and to other locations, thereby hoping that we can keep these animals away from the events and minimize the spread of disease. Next slide. And these first few slides that I'm going to go through basically will apply to, if not all species, at least to several species with many of these conditions. So a little later on in the presentation, we'll get to some conditions and some diseases that are more specific to a given species. But it's important for you to understand the variety of normal temperatures among the domestic animals, and to recognize that any animal with a fever should stay home from events. So that doesn't mean that you're necessarily going to be out there taking your animal's temperature several times a day, or probably not even every day. But prior to going to an event, it is a good idea to take a check of your animal's temperature, and keep in mind that the environmental temperature and level of activity can also influence these normal temperatures, may up them by a degree or two, but obviously there's a variety of different normals among the species. Next slide. So the first condition, again, this is something that can affect any of the species, but we'll talk a little bit about diarrhea. And it can be caused by disease, parasites, and stress. It can also be caused by such things as a change in feed or a change in water. Many of you that have been to State Fair might recognize that when an animal gets on that water, a lot of times that by itself is enough to cause some animals to have diarrhea. And usually, if it's just a natural thing, the diarrhea will clear up on its own over a course of a day or two. But if there is disease or a parasite that's causing it, it may need some medical help. Another thing that can be a problem with diarrhea as far as a cause is an abrupt change in feed, and a lot of times animals that are on a high concentrate diet may be more likely to have problems with diarrhea. So if you do have animals that are showing problems with this, and in addition to having diarrhea or maybe showing some lethargy and just not feeling good, it's a good idea to not take them to these events. So the next slide is neurologic on that same slide. Now back up, if you would, Robin, to the one that shows the neurologic. There you go. Neurologic diseases, and there are a few of these diseases that we'll talk about a little bit later, but if an animal is stumbling or staggering or head pressing, falling down, acting like it can't see, those animals with neurologic symptoms should not be brought to the fair, and your veterinarian should be contacted. Next slide. Lice. Lice are a parasite, an external parasite that will either bite the animal or suck blood from the animal. Lice are big enough that they can be seen with the naked eye, and a lot of times they will attach to a hair follicle or a hair shaft, I should say, and cause an animal to rub or scratch. A lot of times, if the infestation is big enough or heavy enough, an animal will lose condition and certainly will lose hair and have a very rough hair coat, and a lot of times a lot of abrasions on the skin. Okay, I'm just looking down through here to see if there's anything else I need to mention. Like I said, you can read through these, but I want to just introduce you to some of these different conditions that can be involved with many species. So let's go to the next slide. Mange. This disease is caused by mites, which are much smaller than lice. Most mites are microscopic, so you really can't see them, and most mites actually burrow beneath the skin, but they cause severe itching, typically loss of hair, and a lot of times abrasions and just rough, raw skin lesions. And these problems usually occur on the belly. They may occur around the eyes and on the nose and the elbows. And again, these can affect many different species. That dog that you see up in that upper left-hand corner is very typical of a dog with sarcoptic mange, and we see a fair amount of this in Wyoming. Next slide. Abscesses. Most of you probably have seen an animal with an abscess. A lot of times where you'll see the abscesses on the jaw or in the throat latch, but an abscess can occur anywhere on the body. It can occur over a joint. It can occur on the udder, essentially any place. And if there's been a puncture wound or a bruise, or in many cases they can be started up by a fly bite that becomes contaminated with bacteria, and then pus will build up. Usually with an abscess, they'll come on fairly abruptly, and in the initial stages of the abscess, they'll be hard and kind of touchy, and over a course of a few days, usually the abscess will do what we call point, and it will begin to soften, and over another day or two, usually we'll get to a point where either it will naturally rupture and drain, or it can be lanced. And in the early stages of an abscess, if they're just a hard swelling, lancing them really doesn't do a lot of good, because all you've got is a lot of cellulitis, a lot of inflammation in the tissues, and when you lance something that's hard like that, all it does is bleed and ooze, but it really doesn't solve the problem. So if an abscess does occur, again, unless you're experienced in dealing with these, it's better to take an animal to a veterinarian and have him or her assess the stage of the abscess and determine whether or not it's at a point where it should be lanced. And when you've got an animal with an abscess, it's best to isolate that animal away from other animals and in an area where cleaning can be done and disinfection. Once an abscess ruptures naturally, there would be a continual discharge of pus and serum from that abscess for quite a long time that could affect other animals. So again, isolating the animal for a while is a good practice. Next slide. Rectal prolapses. Not a pleasant sight, I'm sure not a pleasant thing for the animal that has it. I have seen rectal prolapses in just about every species of domestic animal. Usually these are caused by injury. Again, changes in diet can be a problem that will cause rectal prolapses. Sometimes rectal prolapses will occur during late stages of pregnancy, just from pressures from the uterine reproductive tract and the presence of the fetus under the rectum. But such things as stress, feeding concentrated diets, short-tailed docks, and a lot of times just genetic predisposition can lead to these things. If an animal has a rectal prolapse, in most cases, it is going to require a sort of what you would call a surgical procedure to get it replaced, and generally a purse string suture to hold it in until the inflammation subsides and the animal quits straining and pushing it out. Next slide. Pink eye. This is a disease that's caused usually by bacteria. However, there are some viruses that can also cause this. Usually it will show up with an animal that has a very tender eye. They're sensitive to light, usually have an ocular discharge, and if it progresses far enough, an animal will get the opaque cornea like you see in that, it looks like a horse picture down in that lower left-hand corner. This is a fairly common problem in some areas of Wyoming, more common in the summer than it is in the winter due to the fact that many of these cases are spread and perpetuated by vectors such as flies, horn flies, and face flies, that type of thing. But such things as wind and some other environmental factors, even snow glare or sun glare on the eye, can cause tissues to be very prone to infection by the bacteria and viruses that can cause this. Next slide. Rabies. We do have a fair number of cases of rabies in Wyoming every year. Most of those cases, thankfully, are in wildlife, typically in skunks and bats, but other wildlife has been found with rabies in Wyoming. In the domestic species, we have seen it in cattle, horses, cats, and dogs. And in fact, this year we've had, well, not in 2017, but in 2016, we had a very high number of cases in Sheridan County in cattle and a couple of cases in cats. And this is a viral disease that can affect any warm-blooded species, including humans. And a couple of years ago, there was a human death in Fremont County that was caused by a bat bite in the summer of 2015. So this is something that, although we don't see it frequently, certainly it is a disease that we're concerned about in Wyoming. And just a word of caution, if you see an animal that's slobbering, which is one of the main key signs of rabies, but if you see an animal that's depressed and slobbering like that horse picture up there in that left-hand corner, do not reach into that animal's mouth. Call your veterinarian and have some diagnostics done and make sure that you don't expose yourself, because a lot of the cases of rabies around the country in humans are simply caused by people that have reached into the mouth of a rabid animal. Next slide. You've probably all seen ticks. The one on the left in that picture probably has not had a blood meal. The one on the right has had quite a blood meal. Ticks are very efficient carriers of diseases such as anaplasmosis, Lyme disease, Rocky Mountain spotted fever, many different diseases, some of which are zoonotic, which means they can be spread and transmitted between humans and animals, both directions. Ticks are external parasites that you can see with the naked eye, and a lot of times you'll find them down around the sheath of a horse or a bull, up around the udder on female animals. But the tick can be any place on the body. And before taking an animal to an exhibition or an event, it is good to check that animal for ticks. Even a few ticks can drag an animal down and cause it to be in poor condition. So again, if you're watching your animals close with your project, you can see these things. Next slide. Ringworm, and you can see the picture of the dog's paws there with ringworm. That second picture down, I'm not real sure exactly what that is. The third one on that left side is a human with ringworm lesions on the arms, and then obviously that upper right hand corner one is a cat. But ringworm is caused by a fungus, and it is called ringworm basically because of the circular lesions. But people definitely can get this disease. If it is not treated, it can create some very serious lesions. So it's relatively fairly easily treated even in animals. But again, it's something that is spread by direct contact and either animal to animal, or if brushes or tack or even clothing is shared, the disease can be spread from one individual to another. Next slide. And we saw earlier the rectal prolapse. What you see here is a uterine prolapse. I have replaced many of these over the years in sheep and goats and cattle, and a few of them in horses. They're very rare in a horse, but they do occur occasionally. You're not going to see a uterine prolapse typically in an animal that has not been pregnant or is not. You're not going to see it if she's still pregnant, but if she's recently calved or foaled or lambed, these things can occur, and they are life-threatening if they're not immediately resolved. So if you see something like this, you need to contact your veterinarian and get the animal treated. And in most cases, an animal that's had one of these should be culled from a herd, because if they've done it once, the likelihood of it happening again in a subsequent year is fairly likely. So I've had many of these over the years where I've struggled to get them back into a cow that was laying down in the 30 below zero weather, and you get it put back in and the cow urinates all over you and dies. That isn't how most of them end, but it does occasionally. So anyway, bottom line is with these, if you see them, you need to get a hold of a vet. Next slide. Vaginal prolapses. These can occur in any female, and I've seen these in about every species of domestic animal as well. Usually they will occur anytime from about mid-pregnancy clear through the end of pregnancy, and unless the tissues are really inflamed and end up leading to a possible uterine prolapse, which can happen. But usually once an animal gives birth, the tissues will reduce, the inflammation will be reduced, the edema will go away, and the vaginal tissue will go back inside where it basically will heal. I have seen animals that vaginally prolapsed that never did it again with a subsequent pregnancy, but I have also seen many that did. And so due to the fact that in many cases these things are genetically influenced, it's a good idea to cull these critters when you've got them too. Next slide. Vesicular stomatitis. In the summer and fall of 2015, Wyoming had a huge outbreak of vesicular stomatitis that actually started in Laramie County with one horse that was at Cheyenne Frontier Days. From there, we traced back to its home county, which was Platte County. We found cases subsequent to that in Goshen County, Natrona County, Fremont County, Sublette County. I'm probably missing some. I think we ended up finding cases, though, in about 9 or 10 counties by the time that fall ended. And we had several hundred animals that had shown these lesions. And just to explain this, that upper left-hand corner is our lesions of vesicular stomatitis on the udder of a mare. The next one down, obviously, is a hoof with lesions at the coronary band. The next one down is in the ear of a horse. To the right of that one is the muzzle of a cow. just inside the lip, and then obviously the next one is on the tongue of the horse. But this is a viral caused disease. When it is found in ungulates, so cattle, sheep, swine, or goats, it is clinically indistinguishable from foot and mouth disease. And that's a very serious disease that we don't have in this country. Hope we never do. But the only real difference between vesicular stomatitis and foot and mouth is that this foot and mouth does not affect horses, whereas vesicular stomatitis does. But this is a disease that is very contagious from animal to animal. Vectors such as flies and midges and even grasshoppers can carry the virus from one animal to another. And when an animal gets this, if it's a severe case, they'll go off of feed and water. So it's real serious. You definitely want to check your animal for lesions of this throughout the project year, but especially prior to taking them to an event, because if you've got something that's got lesions like this, the last place you want it to be is at an event where it might expose other exhibitors' animals. Next slide. Now I put this slide up here basically, and we're going to go very quickly through the next 3 or 4 slides that show some pictures of body scoring. But I have the body scoring slides on here because I want to basically impress on you that the plane of nutrition adequacy and susceptibility to disease go hand in hand. And an animal that is not on an adequate plane of nutrition is going to be a lot more susceptible to many diseases. So let's just bring up the next slide and let them take a look at that real quick, and then we'll go on to the next one. Unfortunately, I have seen animals in every one of these conditions, including that body condition score number 1, and even worse than what that animal shows, with horses and cows that actually are on their taking their last breath when we've been called in as the livestock board to look at animals on humane and welfare cases. Animals that get to that point that have just literally been starved to death. And so that's the lowest, that body condition score 1. And then go ahead and go up to the next slide. I would point out too that this condition scoring method goes from 1 to 10. There are some methods that go only from 1 to 5 or 6, but with each number progression to a higher number, the condition of the body is a little bit better. And it gets to the point, go ahead and go to the next slide, where when you get up there to a condition score of 9, the animal's actually over fat. So we would prefer to see animals in this particular method of scoring between a 6 and a 7. Probably some of our show animals that come to some of the county fairs probably a little bit too heavy to make it state fair because they're actually over fat. But I just want to point out that an animal that is not in a good plane of nutrition certainly is not going to have the resistance that an animal that is well fed would have. Next slide. So now we'll move into some of the diseases that are more species specific. Some of these things like this one with infectious bovine rhinotracheitis, the appearance of that eye actually looks very similar. Back up if you would to that one. Yeah, that looks very similar to the same pictures that you saw for pink eye, but this is an actual viral disease that has effects on the eyes, also on the respiratory tract, and can also have an impact on the reproductive tract as well. Typically nasal discharge, fever, conjunctivitis, animals that will become anorexic and in some cases subject to secondary bacterial pneumonias and that type of thing. Next slide. Johne's disease, and we do have a fair amount of Johne's disease in Wyoming. Years ago, we typically only saw it in dairy cattle here, but at this stage of the game, we're seeing it in cattle, in beef cattle. We've also seen it in some areas of the state in sheep and goats. Bison also are susceptible to it. This is a disease that it has been speculated may have some zoonotic component to it because it may be related to Crohn's disease in people. And there is some argument within the medical and the veterinary community about that. But I believe that Johne's probably does play a role in the Crohn's disease. Bottom line is this is a disease that there's no cure for, and if an animal gets it, it's best to cull it quickly from the herd before it has an opportunity to cause spread to other animals in the herd. Next slide. So nasal or ocular discharge, and this is not something specific to cattle. Any animal that's showing a discharge, and what that term mucopurulent means, it means there's a mucousy or a pussy discharge coming from the nose or the eyes. If you see an animal like that, they definitely should not be taken to any kind of an event. They should be isolated and kept away from other animals until a veterinarian has assessed them and treated them. Next slide. Warts, and again, this is one that's not specific per se to cattle. Many species can get warts, but a lot of the viruses that cause warts are species specific, and so the virus that causes warts in cattle, as a general rule, doesn't cause problems in other species. But young cattle are the most susceptible. We have seen a lot of cases of warts to varying degrees of infestation or at a lot of these different shows, and it's best to keep an animal with these away from other animals and away from the show. Again, going back to that, one of the first statements I made about the exhibitions being the showcase for the livestock industry. If the general public sees an animal that's showing like either one of these pictures, they probably think, oh gosh, I don't want to eat something that looks like that, or I don't want to pet something that looks like that. Why would somebody bring something like that to a show? Bottom line is it is a contagious disease, and it just doesn't have a place in the showroom. Next slide, please. So we'll move on to goats and sheep. This picture is of the front end, so the knees actually, of a goat that has caprine arthritis infectious, or caprine arthritis encephalitis, which is a viral infection. Typically will be a problem in young goats between 2 and 6 months of age. However, if a young goat picks this up, the goat will have it for life, and eventually it can get to a debilitating disease causing the arthritic problems. Sometimes it will also cause nervous system signs where a goat will become incoordinated or even go down and not be able to get up and that type of thing. As well as if you look at those bottom 3 or 4 bullet points, some goats will get mastitis from this, or hypogalactia, which is the next term down. That means that they're going to have a reduced milk production. They can also get pneumonias from this, and consequently, this virus in goats, which is a lentivirus, is very similar in structure and function to the same virus that causes ovine progressive pneumonia in sheep. Next slide. KEDS. We most frequently think of KEDS on sheep. I have seen KEDS also on goats, but usually a KED will burrow into the wool on sheep. They look a little bit like a tick. They are an arthropod. I can tell you one thing, they may not be zoonotic, but they can bite the heck out of people. And it feels about like a lobster chomping on you when they get a hold of you. So if you've got an animal that has these things, you definitely want to treat that sheep or goat. There are a lot of products that you can use. In my sheep business, I actually use Ivomec injectable on them, and it does a very good job on getting rid of these things. But even a few of these sheep cats can cause a big problem with wool and the condition of an animal. Next slide. Caseous lymphadenitis. If you've had goats or sheep, you probably have seen abscesses on those animals that in all likelihood were caused by this organism. And it's caused by an organism called Corynebacterium pseudopyogenes. And it sometimes the abscess contents or the pus that'll come out of these abscesses is really nasty smelling. Other times there's absolutely no odor to it at all, but it usually is thick and yellow or green. And when you open that abscess up, you got to squeeze it out because it's not going to be runny and just run out like a staph or a strep bacterial abscess would. The other thing with caseous lymphadenitis is it isn't always found just in abscesses that are external. These abscesses can also be internal in the abdomen or in the chest cavity, and a lot of cases can be so extreme that they create big problems with body condition and general viability of an animal. So if you have an animal that has an abscess, again, I'll stress this, whether it's a caseous lymphadenitis or an abscess from another type of bacteria, such as a staph or a strep, it's very important to keep those animals isolated because if this abscess drains or ruptures and drains and other animals are in the vicinity, they could pick up the bacteria and end up with the same problem. Next slide. Clubland fungus. I probably don't need to talk too awful much about this. Any of you that have been to State Fair with a market lamb or a market goat, we have checked these for over the last several years. Several years ago, we found lots of cases of clubland fungus at state and county fairs. Over time, with the education that we've done, most of these fairs actually have very few animals that are brought to them now with active lesions of these. But this is again caused by a fungus. It is known to be related to animals or to the practices of frequent shearing and frequent bathing. It's rarely seen in animals that actually have wool on them and haven't been shorn. And the reason for that is that the animal hasn't had the exposure when it hasn't been shorn, and it's still got the lanolin on its skin that hasn't been washed off frequently, like what happens at some of these club lamb shows and jackpots, that type of thing. So there are some things you can do to try to avoid picking up this show lamb fungus. Among those are keeping your clippers and your blankets and your combs clean. I would avoid real frequent shearing of a market lamb and avoid real frequent bathing because, again, sometimes being shorn too close, these animals will get a clipper burn or even a sunburn, and they'll be more prone to having problems with the fungus, which the fungus is really ubiquitous. It's an organism that is real common in the environment to begin with. It's just waiting for a place to attack on the animal. And so constant clipping and shearing and bathing just provides an ideal environment for the ubiquitous fungus to to have a place to attack. And the other thing with this is it can cause a very nasty ringworm in people. I've seen numerous people that have contracted this. It's different than just a regular human ringworm, and when people get this, it can be very severe. Next slide. Blue tongue, and I'll talk really briefly about this one. This isn't something that we typically would expect to see in a 4-H or FFA project. You might look at this and think, well, that looks a lot like vesicular stomatitis, and yes, it does. Both things are caused by a virus. Symptoms are very similar. Blue tongue, however, typically is spread by the bite of a midge, which is a small insect that can carry that virus. And usually where we see these cases of blue tongue are in just a couple regions of Wyoming where the midges are endemic and will overwinter and can cause some big problems. Typically this disease is going to show up in late summer and early fall. Next slide. Pizzle rot. Again, we won't go into a whole lot of detail on this one. What you're seeing there in that picture is the penis of a ram that has pizzle rot. It's caused by a bacteria that can get into the sheath. It can occur in females as well, not just on a male, but the bacteria will get onto the urogenital tract where there's urine scald, and if it stays moist and isn't treated, this can be a real severe type of infection. Next slide. Sore mouth. Anybody that has had goats or sheep has most likely seen sore mouth. People can also get sore mouth, so if you have an animal that gets this, you want to be very careful if you're treating it or handling that animal to use protective gloves so you don't pick it up. It's viral caused. It is very highly contagious. It goes by the other names than sore mouth. It can be called contagious eczema or scab mouth. I have seen cases of this so severe that sheep will refuse to eat and lambs will refuse to suckle. And I've also seen ewes and nanny goats that have lesions on their udder. So it can be pretty severe as well. And there is a vaccine for this that's pretty effective. So if you had a problem with sheep with it or goats with it, it can be prevented. Next slide. Robin, can you tell what slide number we're on? Okay. Well, while we're waiting, scrapie is a disease that we fortunately have not had a problem with in Wyoming for nearly 10 years now. It's a disease that's caused by a prion, which is an abnormal protein that animals can pick up usually at birth. It's ingested from the birth products actually of an infected female. And it's been a big problem nationwide, and as a result there has been a national eradication program for scrapie. This disease is the reason that we require a scrapie identification tag in Wyoming in all exhibition animals. So you probably have seen a scrapie tag. It might be a metal white tag, or it might be about any color, plastic type of a tag in the ear of the sheep. And this disease can cause neurologic symptoms, and I'm not going to go into too much more detail in it unless there are questions later on this, because we have not seen this in project animals for a number of years. Next slide. Next slide. Okay, oral plaque. This one used to be called ear fungus, and it's actually not caused by fungus, but it does look fungal in origin, but it usually shows up on the inside of a horse's ear. And another thing I should have mentioned when we were talking about vesicular stomatitis, sometimes vesicular stomatitis lesions will show up in the ear, and they also look very much like this oral plaque. This problem can be spread by flies. It is suspected that it's caused by a virus. In a lot of cases that I've seen, there's also secondary bacterial infection in it. But when a horse gets this in his ears, he is extremely reluctant to be bridled or haltered, doesn't want anybody touching them because those ears are extremely tender. Next slide. Okay, warts. So a lot of times this is called equine viral papillomatosis. This is a relatively minor case of it shown in this picture. I've seen horses with their entire face covered with them, up both nostrils and in the commissure of the lips. Can be very, very tender to horses, although in a minor case of it, it's probably not too much of an irritant to the horse. But it is fairly infectious and contagious from one animal to another. And again, it isn't something that belongs in the show ring where you're trying to impress the public with the quality of your animal. So probably not a whole lot more we need to talk about on that, but if you have a horse with warts, leave it home.
So you're on slide 39, Dr. Logan.
Okay, I think we're okay on time.
You're doing great. Yep. I'm watching you. You're doing good.
Okay, let me know if I'm going too long. Strangles. This is a very important disease in the horse industry, and it's caused by a strep organism, very similar to the organisms that cause strep throat in people, and there are several types of strep. This disease actually can be spread to humans. I'm aware of at least 2 cases, one of them being in California and one of them being in Colorado, where a horse owner with horses with strangles contracted the disease and got very, very sick. And that's fairly rare, but it can happen. But this organism causes abscesses, usually in the throat latch and under the jaw, under the tongue. They usually will get to the point where they're extremely tender to the animal, and they will mature and point or break and drain for quite a long time. And it's an extremely contagious disease, especially in foals and yearlings and up to 2 years old. Usually once a horse has had this, they will develop a pretty fair lifelong immunity. But with that said, I have seen older horses with this disease as well. And if you get an animal that has this, it needs to be treated, needs to be seen by a veterinarian, needs to be isolated as quickly as you can, and certainly does not need to go to the fair. Next slide. Thrush. This slide is in here. Usually one of the first signs you'll see with thrush is a kind of a subtle lameness in the early stages of it. And when you're cleaning out a horse's foot prior to using it, thrush has a very distinctive odor. Where did that picture come from? Are you guys still all seeing the hoof?
No, I've got the picture too.
Oh, okay. I'm glad. I wouldn't know how to fix it, but I bet Robin can. Anyway, talking about thrush, it can be caused by several different things. In fact, usually there is a fungus involved in thrush, but many times there are bacteria that are involved in it as well. Usually it is because there is manure and mud and moisture that gets trapped up in the frog area, and then it can undermine the sole as well. But it's got a very distinctive odor. If you've ever smelled it, you won't forget it. Keeping your horse trimmed and keeping those hooves cleaned out will help to prevent this. Also, keeping your horse in a dry area. Horses that get thrush are those that have been in a muddy pen or a dirty pen, or a lot of times even on irrigated pasture. So it can be prevented. It can also be treated, but in bad cases, it a lot of times requires a lot of tissue trimming and that type of stuff, plus medication to get it cleared up. Bottom line is it can cause a fairly severe lameness if it's left to progress. Next slide. Equine herpes virus. This disease is also known as rhinopneumonitis in the horse. The virus can cause several syndromes, usually a very subtle upper respiratory problem that a lot of people miss. And if you've got horses and every one of them was tested, a majority of those animals would probably have a titer for equine herpes virus. We don't worry so much about the respiratory syndrome in this disease, but it can also cause mares to abort late-term foals. It can cause weak foal syndrome and pneumonia in foals. And actually the most significant syndrome that this virus will cause is neurologic syndrome. It's what they call equine herpes virus 1 neurologic. There is a vaccine for equine herpes virus, but the vaccine has not proven to be very effective in preventing the neurologic syndrome. And once a horse gets that neurologic syndrome, a lot of them, probably a third of them, will get to the point where they either have to be put to sleep or they die of it. So it is a serious problem. Again, this is a good reason to take your horse's temperature fairly frequently, and especially before and at exhibitions. Places such as exhibitions are an ideal place for horses to become stressed and to become exposed to a number of different diseases, including herpes virus. So watch for subtle symptoms of this disease if it gets into the neurologic syndrome, such things as just a subtle hind leg lameness, dripping urine, a lot of times a droopy lower lip. That type of thing can be real early signs of neurologic herpes. And if you can catch that early, it can be treated. While I'm on this slide, something that I should have included in this presentation, but I didn't, I forgot to do it, but West Nile virus, which is also caused by a virus. There is a very effective vaccine for West Nile, but the early symptoms of West Nile virus are very, very similar to the neurologic symptoms of equine herpes. Next slide. Okay, this disease we have seen at a few fairs. We've had veterinarians that were checking animals at fairs or checking animals to issue a health certificate so the animal could go to the fair. And they called me up and saying, I've got an animal here that's showing erysipelas lesions. Erysipelas is actually the scientific name of this diamond skin disease, and it's caused by a bacteria. Does cause typical pattern lesions, looks like diamonds, and they're scattered a lot of times all over the back and the hips and the hams, like you can see in those pictures. This disease can lead to death in pigs. More frequently, it just leads to anorexia, vomiting and diarrhea, pig that gets a fever. Sometimes they will get arthritis and other things, and like I said, it can lead to death. So if you have an animal that develops lesions like this, contact the veterinarian and don't take the animal to the fair. And the other thing, and I'll just bring this up now, with any of these conditions or diseases that we've talked about, as you're observing your animals at a fair or an exhibition or an event, if you see signs of these diseases, isolate the animal away from other animals, contact the veterinarian, and do all of the other exhibitors a favor by getting that animal away from their animals where there won't be any undue exposure, and hopefully a wreck can be avoided. Next slide. Greasy pig disease. We don't see this disease a lot anymore, but we used to see it a fair amount. It's caused basically by bacteria, usually a staph bacteria. It can also be confused, and a lot of times it can be in an animal concurrently with other conditions such as mange that you saw the pictures of earlier. So not all of these diseases read the book and just show the signs that the book says they're supposed to do, and a lot of times some of these diseases will piggyback with each other. Pigs with this disease actually have a fairly distinctive odor too, and they actually feel greasy and they look greasy. Fortunately, with this one, with this staph infection, it's fairly simply treated with antibiotics. But again, an animal that's showing this shouldn't be at the fair. Next slide. This one is called Ojewski's disease. The more prevalent scientific name is pseudorabies, and it's called pseudorabies because it's caused by a virus. It can affect several different species, but primarily pigs, and pigs are the reservoir for this disease. But it can cause neurologic syndrome or symptoms that can be very similar to the rabies virus. Can cause animals that act agitated, they itch a lot. This one can cause abortions. There has been a national pseudorabies eradication program for a number of years. Unfortunately, it's not eradicated in the United States, and it's very, very prevalent in many countries around the world. But we've been fortunate in Wyoming to not have seen it. Whether it's there and just simply hasn't been reported, I don't know, but we've never seen this disease at a Wyoming fair to my knowledge. Next slide. Swine pox. This one is caused by a virus. It'll create little lesions, kind of crusty, scabby lesions. Sometimes it'll start out like a little, almost looks like a boil, and then it will kind of dry out and get crusty, and you can actually pick at the scab of this thing. When you do, you'll end up with a kind of a serumy drainage from it. This disease might be able to be transferred to people, so be careful with this. Any of these pox viruses can jump species and cause problems in other species. So usually these will create quite a bit of what's called pruritus or itching in the animal that has it. And if it can also be spread by lice and mites and flies, that type of thing. It can also be spread from one animal to another by direct contact or by brushes and curry combs and that kind of stuff. Next slide. Atrophic rhinitis. We have actually seen cases of this at some of the fairs, and why these pigs were ever at that fair, I would wonder if a veterinarian maybe didn't write a health certificate without actually doing an examination on the animal. And I know that unfortunately that occasionally happens. It shouldn't happen, but it does. Atrophic rhinitis basically means that the one side of the nose internal part of the nose becomes affected in the turbinate bones with a bacteria called Bordetella bronchoseptica. And the pigs will become infected. They'll usually act like they've got a cold. They'll sneeze. They have a nasal discharge. Sometimes it's from both sides of the nose. Sometimes it's from just one. But as you can see on pretty much on both of these pictures, the nose will deviate, or the snout will deviate off to one side because there's a difference in the way of the growth of the turbinate bones. So typically, the disease doesn't kill an animal unless it develops a secondary infection that maybe ascends up into the lungs or something, but it's not something that the industry wants at shows. It's not a good showpiece for Mother Nature to show the best and the brightest. Next slide. Poultry. Avian influenza virus. This one is also known as fowl plague. The disease, the viral disease in the poultry that we are really very concerned about is what's called high pathogenic avian influenza, or HPAI, and it's caused by an avian virus that has many different strains and many subtypes. And in fact, just yesterday, we, with the National Assembly of State Livestock Health officials, had a conference call because this disease was found on Saturday down in Tennessee, and they had to depopulate, I should say, a poultry flock of over 85,000 animals. We've had a lot of problems with avian influenza virus in the last couple of years, with a major outbreak late in 2015 and a smaller but still significant outbreak in 2016, where numerous turkeys and chickens and laying hens were depopulated. And the reason for that is because this is such a contagious disease amongst fowl and poultry that if it once gets the jump on you and starts to replicate, it will spread very, very quickly from barn to barn. The most recent case, as were the ones in 2015 and 16, were carried and begun by wild waterfowl. So certainly a big problem in the poultry industry, and we don't want it at fairs. It could create major havoc if it was to show up at a fair. Next slide. Curled toed paralysis. This is what old men get. You're supposed to laugh. Well, I can see you are laughing, Logan. Good. This one is caused by a vitamin deficiency, typically a deficiency in riboflavin in the hen or in the chick's ration. And it will lead to toes in poultry, typically in chickens, but this can occur in waterfowl as well. But it just creates problems with the extremities, poor growth, leg muscles get atrophied and flabby, and ultimately it will lead to death. So it can be prevented by good nutrition. Next slide. Rabbits. Okay, this slide, you'd be surprised how many rabbits we find with this problem. And once it gets going in a herd of rabbits, in a rabbitry, it can spread very quickly. Caused by a mite, and there's a couple of different types of mite that can get in that ear, and if it goes clear down the ear canal, what you can see in this picture is just on what's called the pinna, or the external part of the ear, and it will get very, very crusty. Can be quite a problem, but sometimes it will actually gravitate right down the ear canal and can be fatal. If this is caught before it gets to be too much of too extensive in an animal, It can be treated either with injectable insecticides or topical things. However, in a lot of cases, it will damage the musculature and the cartilaginous structure of the rabbit's ear. And again, this one can be spread very quickly. Next slide. This one would be more commonly called sore hocks, but it's pododermatitis, and typically this one is caused, actually probably begins with a physical injury with rabbits that are either in a cage that is too wet, not clean, so the animal, the foot, leg part becomes contaminated, or in animals that are constantly stomping, even if they're in a clean, dry cage. A lot of times if they're on wire, I've seen this a lot of times in buck rabbits that'll get to stomping around and they hurt themselves, and then they'll get a bacterial infection in it. This can lead to arthritis and severe infection that can end up going systemic in the animal, and rabbits are pretty sensitive once they get a bacterial infection. So best thing on this is number one, to treat, not to treat, but to prevent by keeping cages clean and dry. But if an animal does get this, treating that open wound topically and with bandaging to prevent further contamination, and then systemic antibiotics are necessary. Next floor, next slide. Rhineck. This disease, and I've seen quite a few cases of this over the years of my practice. It's caused by a protozoan called Microsporidia, and fairly common disease. You would think, and in fact I have seen this a lot of times associated with either the previous two conditions, animals that are infected with something, either like the sore hocks or with pneumonia or with the ear canker. But a lot of times an animal with Rhineck may look perfectly normal, may be eating, look just fine, and within a matter of hours will develop this, what they call torticollis, or the neck just twists over to one side, and the animal is not able to right itself, not able to stand. And it's very, very rare in my experience to see one that develops this actually get better from it. I've seen and have treated animals with this, with both anthelmintics and antibiotics. Occasionally you'll get one that'll survive it, but the majority of them do not. Next slide. Dogs and cats. I think we're getting close to the end. Ear mites, and that picture is difficult really to kind of figure out what we're dealing with, but what that shows, it looks to me like it's probably a Pomeranian dog, and you're seeing the ear picked up and you're looking kind of down the ear canal. And ear mites they're a spider-like little mite. They're not microscopic to the extent that the other mites that we talked about earlier are, but you do have to have a little bit of magnification to identify them. They like the ear canals in dogs and cats. They like it where it's dark and warm and moist, and that ear canal is an ideal place for it. This can lead to other problems with infection in the ear. Yeah, the slide says they're maybe found more commonly in cats. I don't even know that I would agree with that, but fairly common finding in companion animals. So definitely check your dogs and cats for these things before taking them to the show. A lot of times the symptoms that you'll see with these is an animal that's just constantly shaking its head or digging at its ears. And again, when you look in that ear canal, you're going to see kind of an almost black, dark reddish brown, a lot of times very dry, exudate or kind of scabby appearance to the external part of that ear canal. Next slide. Hopefully we're not going to see canine or feline distemper at any of our events. And we don't see the number of cases of either of these two diseases anymore like we used to years ago, largely because most of the animals have been vaccinated. These two diseases are very distinctly different. The cat distemper is caused by one virus, canine distemper caused by another, but the respiratory and digestive tract symptoms that they cause in their respective species are very, very similar. The picture on the left, on that upper left, is actually a picture of what's called hard pad in dogs. Cats don't get that as often from their virus, but in dogs, the virus a lot of times will create an epidermal lesion, and it just destroys the epidermis, which then becomes very, very hard, and those pads will just be like rocks. And of course, the other picture is basically showing the nose and the eye lesions and pathology that shows up in a dog, but the feline distemper will look very similar to that in a cat, with a lot of nasal discharge, a lot of ocular discharge. Usually these diseases will lead eventually to a pneumonia and multi-system pathology. And generally dogs and cats that get either one of those viruses are going to succumb to it. Next slide. Fleas are pretty darn common in dogs and cats, even in Wyoming. They're not maybe as common up here as they are in more humid, moderate, temperate climates, but we do have fleas in Wyoming, and fleas are pretty common not just in dogs and cats, but fleas are really common in prairie dogs and wild rabbits, so even domestic rabbits can certainly become infested with them. They're primarily an annoyance, but they can cause other diseases. They can cause lesions on the skin and in the ears and other places that give rise to opportunity for other pathogens, bacteria and viruses both, to enter an animal's body. And obviously there are treatments available for these little critters, but check your animals before they're taken to a show to make sure that they don't have fleas and spread them to everybody else. Next slide. That might be the last one. I think it is. Is it, Robin?
That is it. So I'm going to go
Okay.
ahead and unmute everyone, Dr. Logan, and just or remind you, if you have some questions for Dr. Logan, to please unmute yourself so that he can hear you. Let's see.
I was just wondering if we could go back to the temperature slide so I can look at the temperatures of the other animals that I didn't get written down.
Oh, goodness. Okay. Let me reshare.
I think it's about the third or fourth slide, probably, Robin.
Yeah. Hang on a sec. I'm going to have to reshare and pull that up. Just so you know, also, there will be we'll be posting this on the website, your WyoLearn. So probably tonight or tomorrow it'll be up. So you'll have access to the whole thing. Hang on.
Which ones are you missing, Michelle?
There we go. Let's see.
The last one I got was rabbit.
Tell me if you can see that now. Not yet?
Not yet.
Not yet.
There it is.
Okay. Thank you.
You bet.
And keep in mind, too, that these are average temperatures for a species. And any individual may have some variation. You know, one animal may run a degree lower or a degree higher and be perfectly normal. But typically, if your animal is within half a degree or so of this average, they're probably okay. And again, keep in mind that the environmental temperature and activity level can play a role in the temperature as well.
Okay, any other questions for Dr. Logan?
I was wondering if you could tell me about coccidiosis, what you know, what signs to look for it, and what medication you know of treating it that works best.
Sure. Coccidiosis can occur in cattle, so both dairy and beef cattle. It can also occur in goats and sheep, and it's caused by a protozoan. Typically, the first things you're going to see with coccidiosis is going to be a runny diarrhea, an animal that will develop a fever. A lot of times they'll go off feed. A lot of times they will kind of hump up and strain. And in many cases, if they're not treated, the diarrhea will eventually progress to a bloody diarrhea. Coccidiosis also, if it's not treated successfully, can also lead actually to neurologic symptoms. The best treatments actually are the sulfa drugs, Albon, some of the water treatments like sulfas. There are preventions such as monensin and rumensin and the names are escaping me right now, but there are some good preventions that, by the way, actually are not affected by this new veterinary feed directive. So you can still buy those products over the counter. But if you get a recalcitrant case of coccidia, it's the best idea to contact a veterinarian. Some cases you end up having to go with IV therapy with antibiotic as well as fluids to try to keep those alive.
Okay.
Does that answer your question?
Yes, it does. Thank you.
Any other questions? Okay, Dr. Logan, I thank you for joining us tonight. I appreciate this. I think it was really educational for the participants, and the rest will get to watch you on video. So thank you, everyone. Thank you, Dr. Logan.
Thank you, Robin.
Thank you.
You bet. And guys, watch your announcements in WildLearn. Your quiz will be up for this course in about an hour or less. So, and then watch your announcements for our next session, okay? All right. Thanks, everyone.
Bye.
Goodbye.
Thank you. Bye.
Thank you.